Hello and namaste. This is Dr. Srinidhi Chidambaram, and I'm presenting the COVID Care series presented by Apollo Hospitals. I hope you're all okay, and I do hope that you're all continuing to observe all the COVID 19 precautions. And I hope that you are finding our COVID 19 care series useful and relevant. We have, as you have seen over the past weeks, discussing a lot of topics related to COVID 19, and you can still find them on our Facebook page if you have not yet viewed them. COVID 19 is a disease that affects people differently. Some have an incredibly smooth course with just a few days of being unwell, but some of them end up needing intensive care. There's therefore been a lot of interest in studying what makes a person get severe COVID 19 with all the complications of organ damage or a cytokine storm or hypercoagulability. Several factors like age or diabetes have been identified, but one such risk factor is being overweight or obese. Obesity can cause severe or poor outcomes in COVID 19, not just because people with obesity have an increased prevalence of diabetes or heart disease, but they say that obesity itself is a major risk factor because it interferes with immunity and also creates a state of inflammation in the body. It therefore becomes all the more important that people who are overweight take all measures to bring the weight down by taking various lifestyle changes and therapy and consultations, and also need to be very cautious that they are vaccinated and they are staying very safe regarding COVID 19. Not many know that obesity is a risk factor by itself for severe COVID 19 infection. And to guide us on this very important topic, we have with us today Dr. Arun Prasad, a very senior and renowned gastrointestinal and bariatric surgeon from Apollo Hospitals, New Delhi. Dr. Arun Prasad is a renowned specialist in surgical gastroenterology, bariatric surgery, robotic, and general surgery. And he has over 35 years' experience as a surgeon. He's one of the most experienced surgeons in India in these procedures, and particularly in laparoscopy, advanced laparoscopy, single incision laparoscopy, bariatric and robotic surgery, and bariatric endoscopy. A medical graduate from the Armed Forces Medical College, Pune, he did his master's in surgery from the Maulana Azad Medical College, New Delhi, and went to UK for higher surgical training in GI surgery. On his return, he joined Apollo Hospitals as one of the youngest senior consultants and was conferred with the prestigious FACS USA in 2019. He has been a pioneer in advanced GI laparoscopy, thoracoscopy, bariatric and robotic surgery in India with many firsts to his credit, and has also performed over 6,000 laparoscopic cholecystectomies, 2,000 laparoscopic hernia surgeries, and in bariatric surgery, in which he is a pioneer in India, in patients over 250 kgs, over 1,000 surgeries, and also a pioneer of several endoscopic bariatric surgeries and robotic thymectomy surgeries, and also thoracoscopic and robotic bariatric surgeries. Welcome, Dr. Arun Prasad. I'm so happy to have you here participating in our COVID Care series presented by Apollo Hospitals. I'm sure your valuable insights will be very, very useful to our viewers, guiding them to better health and fitness and well-being. Over to you.
Thank you very much for those kind words of introduction, and congratulations for hosting this wonderful series, which is going to be useful to everyone. So we are talking about COVID and obesity. So it was interesting to note that we did a study at our hospitals in Delhi when the COVID started. And what we found was that 65% of the patients who were admitted with COVID were obese. And so, more interestingly, when we analyzed the deaths, people dying out of COVID, we found that 80% of the people who died had obesity. So this is quite an alarming figure, which we came to, and this is under publication. It was carried in the newspapers also, our study. And what it means is that, if we have 1,000 patients, 650 would be obese, if we have say 100 deaths, 80 out of those deaths would be of the obese. So when we found these startling statistics, I went into literature study and tried to find out more about this. So I'll be using few medical terms because there are no alternative English simple terms. So one thing that happens in obesity is that these people also have high incidence of diabetes and blood pressure associated with obesity, which also makes things worse. So these patients have what is known as a low-grade inflammation. Inflammation means some kind of a swelling which is there inside their blood vessels, inside their body. And this low-grade inflammation means some cytokine levels are already high. So as Srinidhi mentioned the word cytokine storm, which people must be reading in the newspapers, it's there in the TV. I think now even kids know about it. So when that stage comes, that gets actually worse. And some of the cells, the protective cells, the numbers are lower. So that makes it difficult for these obese to face the problem. We have some receptors, what we call as ACE2 receptors. Basically, it stands for ACE. It's a complex name. And these receptors, the coronavirus goes and attaches itself to these receptors. So these receptors are required for the body for certain protective enzymes and chemicals to be produced in case of an infection. But because the virus has blocked, the levels of ACE enzyme goes down and again makes it difficult for the body to fight. The presence of diabetes, increased sugar, if the patients are being given steroids for COVID, the sugar is going to shoot up much more. It's going to be a big problem. These days, we are hearing about black fungus in patients who are getting a lot of steroids. So that again makes matter worse. Another chemical which people would have heard is IL-6. People who have had relatives who have undergone COVID treatment would have seen IL-6. Kya level, what is the level, what is the level, people discussing. Then we have another problem that these people who are obese, they have obesity syndrome, which means their ventilation, their oxygenation in the body is already a little compromised. So when corona comes, if you get a corona lung, corona pneumonia, so already compromised lung becomes more of a problem, and that has an effect on heart, can cause to heart failure too. They have weaker muscles compared to other people. So, just as simple as people climbing upstairs. So you'll find obese finds it difficult to climb upstairs. And when it comes to fighting COVID, it's not stairs. We are talking about the person climbing a mountain. So, that kind of an effort is needed. So these things make it difficult for people who are obese to fight the infection. Plus, it makes it easy for them to get the infection. And unfortunately, the mortality rate in these people are also high. So that's a little background about the disease. I could say a few words further on other problems. There are certain logistic problems. Somebody who's obese, to get him to the hospital is a problem. You need ambulance where the beds have to be wider because the number of obese, if more obese are getting COVID, then we need more obese beds. The stretchers or the trolleys which you see in the hospital most of them are not suitable for an obese person. Obese person needs special cuffs for checking their blood pressure. Lots of special things are required. So if you have a large number of obese patients coming, then you're going to have a relative shortage of these things. So these are, some of the logistic problems which the hospital and the doctors also face at this time. Lastly, coming to the point, what can we do? So of course, losing weight, that's a separate topic altogether. Maybe I'll have a meeting on weight management at a later date. But for losing weight, you need to be having a diet pattern, which is a healthy diet pattern. So obviously somebody cannot lose weight immediately, but to start with, have a balanced diet and make sure certain chemicals are there in your diet. So when I say certain chemicals, I'm talking of the vitamins, like vitamin A, which is very important to keep the linings of our lung healthy, because that's where the virus is going to enter. Vitamin D, vitamin C, which has what we call as antioxidant features. So that's antioxidant is very important to wash off the toxins of the body if God forbid you get this kind of an infection. Then there are certain chemicals like magnesium, selenium, zinc. These days with the internet, you can go on the net and look for it, search for type whatever I'm saying. You'll be able to find a lot of sites which will give you advice and of the importance of these chemicals. Protein is very important. So what you could do, God is very kind. The seasonal vegetables and fruits which are available in wherever you are living is the best source of vitamins and minerals. So you don't have to, pop special pills, because I know there are a lot of people who are going around having too many pills, which also has been suggested as one of the cause of the problems. So don't talk about the pills, just go in for simple diet, which is available locally. The local fruits and vegetables are your best bet. Have a healthy, balanced diet. Go for exercises. You can do yoga at home. Go to the YouTube. People who are obese, you need to kindly note these words: low impact exercises. So when you go to YouTube, you have to type low impact exercises, because these are the exercises which are meant specially for the obese. You could be sitting on the chair, sitting on the bed, and doing these low impact exercises without harming your knees and ankles and your bones. So in nutshell, this is the kind of approach we need to make. If there's anything I missed out, Srinidhi, you could ask me, I could cover that too.
Doctor, you were saying that, of course, we know that obesity is a risk factor. How does it worsen the outcomes apart from the ACE, the receptors that we spoke about? Is there any way that it worsens the other organs which are damaged, like the heart, or does it all work the same principle of inflammation and
See, obesity, as I say, is the mother of diseases. So whenever somebody has obesity, they have problems with their liver, what we call as fatty liver. They have problems of reduced respiration, as I mentioned. There would be some changes in the heart, kidneys. So it's affecting your entire body. And COVID infection is such that it tries to get all resources. The body has to really fight very hard. So when it comes to the fighting, the person who's obese is already starting in a handicap. It's like golf. You start with a handicap because you are already down. Your IL-6 levels are already high. Your pro-inflammatory fluids which are there are already high. Your cells which fight the infection, the levels are already low. Your ACE receptors have got blocked. Then there are micro thrombi. So in COVID you can get very small clots, and these can damage the lining of your blood vessels, which are already, as I had mentioned earlier, swollen. So if they are already swollen, they have plaques, then the chances of complication. So most of the time when you are talking about mortality, you'll find that the person has not died out of pneumonia. They would die out of a heart attack or a stroke or some kind of a vascular problem. So that's the mechanism for the death, even though the illness is more focused on the lung.
So does this apply to only the morbidly obese or even the slightly overweight? So how do you classify it BMI based? Of course, the more morbid obese or morbidly obese, you are the more
right. Yeah,
but
sure.
How does it affect the people who are also mildly overweight, not exactly in the ideal weight range?
See, those who are say mildly overweight would be mildly compromised. So maybe just one level of disability when it comes to golf, or if you watch F1, your car is just one level behind compared to the morbidly obese car, which is way behind. So it's just again a grading. And talking about BMI, which is body mass index, people who are not aware of this body mass index, again you can go to the net. You can type body mass index. There are lots of sites which will tell you. You just have to enter your weight and height, and it will tell you your body mass index. Unfortunately, for the Indian subpopulation, the risk is 2.5 less. So if we call someone with a BMI of 30 obese in the West, in India, we'll call somebody with a BMI of 27.5 obese. And that's one of the reasons why incidence of diabetes in India is so much higher. Like, we are the diabetes capital of the world. And diabetes is really creating havoc when it comes to treating COVID, whether it's the COVID itself or whether it's the post-COVID infection. And this diabetes gets worse with obesity. It gets worse with the steroids, which are such an important part of the COVID treatment. So, it's not a good situation to be if you're obese. So the people who are obese must follow the 3 rules: the mask, social distancing, sanitization, much more rigorously than the non-obese, because you don't want to get COVID, and you try and follow the diet instructions which I have given, so that your immunity level also improves.
Could we talk a little more about losing weight, doctor? Because now supposing, now of course nothing can be done in a day if somebody is already obese. But
Sure.
apart from the diet and the exercises, I mean, is there anything more on the diet and exercise, or something on cutting the carbs or the fats, or anything that,
Sure. Sure.
I don't know
So
how much
it's
it will help now,
yeah, sure.
somewhere you have to make a beginning, right? So can you give us a little more detail for people to really think about how they're going to start to lose weight, right? Even now is not too late, kind of thing.
Sure. So one is that, your certain lifestyle issues are also there, like sleeping. So it's very important for people to sleep. Like our parents, grandparents used to always say, early to bed, early to rise makes man healthy, wealthy, and wise. So there must be a reason behind this. And the sleep pattern is very important for the body melatonin and cortisol to function normally. In fact, some people might have read news reports of how people in the West are popping melatonin pills to avoid COVID, and some publications are also there. So best way to get is natural melatonin. You sleep on time. And in the COVID era, what I've noticed and what people tell is that the sleep pattern gets disturbed very much, and people are sleeping later and later since whenever there is a lockdown. So that is something you need to actually be conscious about and fight. When it comes to diet, there are 3 parts of the diet. One is carbohydrate, second is protein, and third is fat. So carbohydrate, we need to avoid what is known as a high glycemic index carbohydrate. These kind of carbohydrates, like white bread, again, you can go to the net and look for food which is high glycemic index and the food which is low glycemic index. So you want food of low glycemic index, which stays in your body for a longer time, which is better for your insulin levels in the body, because the high glycemic index food gets absorbed very rapidly. So when it gets absorbed very rapidly, your insulin level also shoots up very rapidly. Insulin levels high means fat gets deposited in your body tissues, in your liver, and it goes up rapidly, then it comes down rapidly. So as you would have noticed, if you have something like plain noodles or something, Maggie, after half an hour, you will feel hungry, because it's a high glycemic index food. It will get quickly absorbed, the insulin level will go up, and insulin level going up will not only deposit fat, it will also bring your blood sugar down. So you'll start feeling hungry. Low glycemic index food, we don't have so much time. Again, as I said, you can go onto the net, multigrain bread, whole, seeds, legumes, green leafy vegetables, fruits, all these provide you a lot of low glycemic index food. Moving on to the protein, any form is good. Please have protein. If you're veg, go for soya, paneer. If you're non-veg, go for, egg white, grilled chicken, fish, these kind of things. When it comes to fat, please take vegetable fats. So vegetable fats are actually good because they provide you energy, and they will have a sparing effect. It won't make you feel that much hungry. The craving for carbohydrates will reduce. So a lot of people want to have zero fat. That's also not very good. And so these are the 3 elements of the diet which we are talking about. Have a balanced diet. It should always work for you. If this doesn't work, you are talking about post diet.
Yes.
So if the diet and exercise don't work, then we do have, I'm a surgeon, so I have methods of, endoscopically reducing the stomach size, or putting in a balloon, or doing what is known as bariatric surgery by laparoscopy, which some people might have heard, things like gastric bypass. We also do this surgery by robotic technique. So, that becomes endoscopic and surgical options, which in fact, a lot of people are coming to me because of the lockdown. People have gained weight. And one new indication I found, the first patient in COVID who came to me for bariatric surgery, he was a lawyer in the Supreme Court, and he says, with the mask, I cannot walk so much. I was having difficulty in walking earlier. Now with the mask, I just can't walk much. So I have to reduce this weight. And he was about 210 kgs. Obviously, diet and exercise would not have worked. So we did his bariatric surgery in the first lockdown phase itself.
So that brings us to also this working from home and lockdowns when people do not, they're staying at home more. So there's also, in a way, temptation to order more food or exercise less, watch TV more. And even when they're working, there's a lot of sitting instead of moving about. So is there a lot of weight gain and obesity during these lockdowns and during
Yes.
pandemic time? And what can we really do to avoid that?
Sure. Yes, there has been an increase. I recently operated on someone, young girl, who had gained a lot of weight. She had gained her entire weight during lockdown. And so one has to be careful. And as I said, lifestyle like sleeping. Sleeping is the simplest thing. Drinking a lot of water. The diet, what I have advised, try and follow that diet. Try and fill yourself in with more roughage. Have more fruit, more vegetable. And there is one more thing which I missed out. That is, we have to go by nature. So nature has made sunrise and sunset for a purpose. During the daytime, when there is light, nature made that people go out of the caves, go hunting, find food, eat. When it becomes sunset, nature is supposed to say, close down. So you need to close down, go to sleep. That's how our hormones work. So one single advice, one takeaway factor which you want from my entire talk, if you want to lose weight, avoid cooked food after sunset. That's why how nature wants us to be. If you do that after sunset, just have vegetable, fruit, have as much as you want, but no cooked food. People are used to doing the reverse. Morning they are in a hurry, they pick up a sandwich, run to the metro or run to the bus or to your work stay. At lunchtime, you don't have time because there's meeting, there's surgery, there's something else happening, grab something. Evening, you come home, you are totally exhausted and you eat and eat and eat and you go to sleep. All that food is going to get assimilated in the body and you will gain weight. So be conscious of that. Try and do that. So this is one single take home message which I'm trying to give. Avoid cooked food after sunset.
Doctor, what about children? Today we hear that first we also heard that in this wave and in the coming waves, the children are getting more affected by COVID. But there's also this whole thing about children who are now mostly at home. So they're not going to school, they don't have sport, they don't have the option of going out, socializing, playing. So a lot of them are also spending time sitting, either doing online classes, or parents also don't know what to do with them after some time, so they give them an iPad. So we hear about has that increased childhood obesity, and how
See, we don't have exact data, but for the reasons you have mentioned, there has to be an increase. So there must have been an increase. A lot of people I know, they have got some home exercise devices like, exercise cycle is there, skipping ropes are there, some hoops are there, ball, they also have some system of exercising on a ball. So the people have found out ways to exercise and, keep their diet under control. I know it is extremely difficult, but unfortunately it has to be done, because even without COVID and the lockdown, India has the second highest number of obese children in the world after USA. Even China is less than us. When it comes to adults, India is number 3, China is above us. But when it comes to children, India is number 2. And a very worrying factor, 25% of obese children, when they grow up, they are going to become diabetic.
So that needs to be really looked into,
yes.
I think.
And it's the parents' responsibility, because the child doesn't take money and go and buy things. It's always the parents who buy things.
Regarding COVID-19 itself and obese people, we did say that they need to be extra careful and somehow ensure that they don't get the infection, because it's not going to be so good for them. But are there any practically, how should these people, should they just stay at home, or what kind of precautions do you think they should take to protect themselves from getting COVID-19?
See, precautions, as I already mentioned, the 3 standard ones, which are your mask, sanitizer, and social distancing. I think mask is the number 1, because even after vaccine, people have got COVID. Even after having previous COVID, people have got COVID. Mask is the number 1 prevention. Then, as I mentioned, healthy diet to improve your immune function so that you have good antioxidant levels, your vitamin A, D, C, B complex, zinc, magnesium, all these are kept in order. So you could even go for investigation. You can have your blood test done to check what your vitamin D3 levels are. If they are very low, then you could be put on vitamin D3 sachets and calcium supplements. So there are things. So you need to maybe go through certain investigations to find out if there are any deficiency, because obese people do have a higher incidence of deficiencies of these. So get those tests done. If you are deficient in anything, please get them replaced by medically and follow the diet.
Is there any support or information that we have to help people who are overweight or obese? Could you tell us of any programs that we may be having, or any resources which would probably help them, as in terms of, I'm sure dietary advice is possible.
Sure.
What can
See, we have
information?
the Apollo 24/7 app through which you could get in touch with us, and we are helping, every evening I've got appointments of talking to 3 or 4 obese people. One thing the COVID has done is it's made India smaller. So I really don't know where a person is calling from. Sometimes I'm getting call from Bengal or even from Hyderabad. Yesterday, somebody from Hyderabad called me. Okay, so it's made things so much because of the online, because they look for things. And then we have a team of psychologists, myself as a bariatric person, and my dietitian is there. She calls and we stay in touch. So whoever gets in touch with us, we go with them, get their diet recall. When I say diet recall, we find out exactly what they're eating, how that can be changed. So minor changes sometimes make good difference. Exercise pattern. And then as we have a good network of Apollo hospitals all over the country, we can advise them where to find the nearest center, who to contact. So we have a good system, and our Apollo 24/7 app may be the good point to start it.
Absolutely. The next question is about vaccination. Are there any precautions that obese people must take, or is there some, don't you think they should be taking the vaccination on priority as well?
Yes, they should be taking the vaccine on priority, and obesity is one of the comorbidities. So initially when the vaccine program started and when we said 45 years plus with comorbidity, obesity was one of them. And I strongly recommend all people who are obese should be vaccinated. Vaccine is not a magic bullet or anything. I have had my full vaccine. 2 months after my vaccine, despite antibody levels, I got COVID last month. So it's not a magic bullet. What I say is it's like wearing a helmet. So wearing a helmet does not prevent accidents, but it might save your life. I did not need to get admitted to the hospital because the severity was reduced. Maybe if I had not been vaccinated, I would have needed admission. So a vaccine is a must, and obese, again, because you are at a higher risk, you must get your vaccination.
We also have a question here. I'll just read it out. Does obesity mean just looking fat, or does it mean overweight, or both? In the sense that I'm eating with limit, doing my exercise, but my weight is high. So what is obesity, this person asks?
Sure. So the simplest definition of obesity goes by BMI, which you had mentioned earlier in the program. And you can check your BMI by your height and weight. You can go online and check your BMI. Any BMI more than 25 is going to put you at a higher risk. In addition to BMI, there are other criteria. Again, I'll not go into details. There are things like, height to weight, waist ratio, waist to hip ratio. Then we have methods of, even doing MRIs to check how much fat is there within your muscles. So those becomes advanced, but the simplest is BMI 25. If your BMI is less than 25, you are relatively safe. If it's less than 22.5, it's perfect.
So I think this was really an illuminating session, and we have learned a lot about weight management. And I think you have really stressed how important this is, because this is often overlooked by people thinking that, this is not going to make their COVID-19 worse, staying at home and also eating without a plan and also not exercising all lead to weight gain. But you have told us that, this is really one of the most important things to look out for and manage the weight so that you're also safe from severe COVID-19 complications. Viewers, if you have any more queries, you can reach out to us on our Facebook page, either as a message on Facebook Messenger, if you need any help, or put it down in the comment section. Thank you very much, Dr. Arun Prasad, and thank you viewers for being here. We will meet on Monday. We're going to talk about learnings from the past 2 waves of COVID-19 and how do we protect ourselves in case the third wave comes by. This is going to be discussed by Dr. M.S. Kanwar from Apollo Hospitals, New Delhi. Meanwhile, take care, be safe, and follow all COVID-19 precautions. And don't forget SMS, which is the social distancing, wearing the mask, and sanitize yourself at all opportunities. Take care, be safe, have a good weekend. Namaste.